Hi, I'm Dr. Mike from Anchorage Dental Care, and today we're going to talk about veneers. Why? Because good things happen when you smile. So what are veneers? Veneers are thin shells made of porcelain or composite that are bonded to the front surfaces of teeth. They can be combined with other treatments such as implants, crown and bridge work, or rehabilitation to complete and enhance the smile. They can be done in multiple ways. They can be done in singular or multiple or mixed and matched varieties, for example, porcelain veneers on the front teeth and composite veneers on the back. Veneers can also be done as part of orthodontic work to complete a total smile makeover. Benefits of veneers are to create a custom, natural look and feel of teeth, providing a significant improvement in appearance and covering imperfections, misalignment, discoloration, chips, gaps, and reinforce weak or worn tooth structure. We often see that veneers can improve overall health by increasing a person's motivation for oral hygiene and home care. Veneers can also protect the surface of damaged teeth and eliminate the need for more expensive treatment. They can enhance oral function and make it easier to chew and speak properly and replace worn and chipped, weak tooth structure. And finally, they greatly improve the appearance of teeth and can boost self-confidence and esteem and change people's lives, as good things happen when you smile. Veneers are long-lasting if maintained and taken care of with our protocols and produced with our meticulous attention to detail. In some cases, veneer treatment requires minor adjustment of teeth, and this can be very minimal and well planned ahead of time. And in comparison to other restorative procedures, they usually strengthen tooth structure. Unlike other treatments, they can be reversible, and if done without tooth preparation, they can be removed without permanent damage to the teeth. Although this may not be achievable in every case. There are risks and side effects to everything in life. And while veneers are very safe if done correctly, and at Anchorage Dental Care we do focus on reducing patient risk as we aim to ensure high quality results that are beautiful and durable for years if not decades, there is always a risk to intervention. These can, however, be markedly reduced through careful attention to detail. We rarely have any issues with our veneers that are produced by us here at Anchorage Dental Care. However, we often see and need to repair other dentists' work, particularly those done overseas. These can range from long-term sensitivity to hot and cold foods and drinks, chipping and cracking and veneers falling off altogether, and patients not correctly being informed how to care for their veneers and what habits to avoid. There are primarily two types of veneers. Veneers can be made of porcelain or composite, and they have their own advantages and disadvantages. However, overall, porcelain veneers are more superior. Porcelain veneers are more durable and tend to accumulate less plaque and stain and change color less over time. They are more lifelike in their translucency and color, shading, and have a glossy appearance. These, however, take longer to manufacture in the laboratory, thus need multiple appointments and are difficult to repair and replace. Composite veneers, on the other hand, are less expensive and only need a single appointment to fabricate and are easy to repair and replace. However, they have a less glossy appearance, can stain particularly at the gum margin, and will wear somewhat over time. All clients are different, but our experienced team at Anchorage Dental Care will recommend the veneers that best suit you and your teeth. In terms of preparation for veneers, we need to carry out a comprehensive oral examination and make sure that the patient is capable of maintaining good oral hygiene. We need to also address issues like decay or cavities and gum disease. For a successful veneer patient, we advise against certain foods and habits, such as eating hard foods, opening packages with your front teeth, etc. With proper care, veneers can last a very long time. In fact, we will be expecting over a decade for porcelain veneers and certainly over 5 years for composite veneers. The process of getting veneers involves an initial consultation and an assessment of dental health, and of course a thorough discussion of the patient's goals. Following that, we would usually carry out a comprehensive examination ensuring that the teeth, gums, temporomandibular joints, etc. are all in good health and capable of this treatment. Following that, we often take photos, videos and intraoral scans. Sometimes we need 3D X-rays such as an OPG or a cone beam CT scan. From there, we create a 2D design to test against the patient's photos. If this is successful, a 3D design is then created from our 2D mockup. This 3D design is 3D printed and trialed in the patient's mouth to measure satisfaction and adjusted and redesigned if required. More photos are then taken for further review. Most patients also whiten their teeth at this stage to reduce the underlying tooth color shining through. For the preparation appointment, many of our anxious patients prefer to have oral or IV sedation for this procedure. It is a very precise appointment, but it's not complex, it's non-surgical, and most of the time we only need a local anesthetic to numb the gum, as we're only removing a small layer of tooth structure to create space for the veneer and provide a smooth rounded surface with no undercuts so that the veneer can be bonded to the tooth. Impressions and scans are then taken and sent to the laboratory where the custom veneers will be created. Of course, temporary veneers replicating the proposed design are placed as a single unit onto the teeth to give the patient a last final test drive of what to expect and look forward to when their veneers come back. The patient will have the chance to test their design over the next few days. When we are sure and confident that the patient is happy with our result, the laboratory then completes the case and returns the veneers back to the practice for bonding. The bonding appointment is usually a very easy procedure that does not need much local anesthetic or sedation. First, the temporary veneers are removed, and then the porcelain veneers are placed and tested onto the patient's teeth to measure their reaction and make sure they're happy. Usually the patients are delighted with their new look, and then we proceed to bond the veneers with very strong epoxy-like adhesive, specially designed for this purpose. We use a product called Veriolink. It is our material of choice, and although it is very expensive, it is the best performing material globally and what all expert professionals use for these kinds of cases around the world. Many times following veneers, a mouth guard to be worn at night is recommended for people that clench and grind their teeth. This helps protect their investment and reduces the chance that the veneers are accidentally damaged by grinding. In terms of cost of veneers, we are all price sensitive, but the truth is, not all veneers are created equally. At Anchorage Dental, we are able to use the best materials and keep our prices competitive, as we do large volumes of these cases successfully. Commonly, for porcelain veneers, we charge about $1,000 for each tooth and $400 for composite veneers. There are also additional fees such as examination, cleaning and whitening if required, but these rarely exceed $800. As each patient's needs are different, we charge a single fee of $99 for initial consultation and preliminary x-rays. This is to make sure that each patient will have the treatment they desire without complication. When you attend Anchorage Dental Care for these consultations, you will receive a personalized quote with all charges, costs, appointments required, and expected treatment timeframe. Often some stronger health funds will pay up to a yearly limit or provide partial coverage for these treatments. So depending on your level of cover, you may need to contact your health fund with the item numbers quoted and get an understanding of how much they will pay towards your treatment. It's not a concern if your health fund doesn't cover veneers, as we also offer in-house and outsourced patient financing options. The staff at Anchorage Dental Care can discuss this with you in person and tailor it to meet your circumstances. Overall, you'll be pleasantly surprised how achievable your brand new smile can be with or without health fund insurance coverage. Superannuation in some circumstances can also be accessed for these medically necessary treatments. Let's look at a few veneer cases together to see how they've improved not only the look but the feel of some patients' teeth. For this first case, we have a singular composite veneer to hide or change the shape of a pec lateral for a younger patient. As he is growing, he is not interested in a porcelain veneer at this point, but that may come over time. Here's another case where we have a singular composite veneer. In this particular case, this composite veneer was placed following a liner treatment as one of the teeth did not move correctly. The patient was overall very happy and satisfied that we finished her orthodontic treatment in time and we corrected her smile with that singular composite veneer. In this case, we have multiple composite veneers that are to restore wear and tear and spacing between the teeth. Here's another case of multiple composite veneers, both top and bottom, to replace worn, missing tooth structure. Again, this is another case where multiple composite veneers were used, both top and bottom, to replace worn tooth structure and enhance and highlight the patient's smile. In this case, we used composite veneers on lower teeth to improve the patient's bite. As you can see, they will come for their upper composite veneers at some point in the future. Composite veneers can also be combined with bridge work. For example, in this case, where a singular missing tooth was combined with what we would consider a resin-bonded composite bridge for an immediate single appointment result for this patient. Here is another single appointment veneer and composite bridge. And in this case, we completely changed the bite of the patient, and he was extremely happy as he felt that he had no hope of achieving a nice smile without dental implants. This is a case where we used multiple porcelain veneers this time to treat a gummy smile with excellent aesthetic results. This is another treatment of porcelain veneers, again correcting gummy smile and overall smile aesthetics. In this case, we used porcelain veneers following orthodontic treatment once the teeth have been positioned correctly to produce their final aesthetic result. And finally, here we have a porcelain veneer case combined with a tooth extraction treatment to treat a tooth with a root fracture. As you can see, we can achieve a lot with porcelain and composite veneers, so there is no need to despair. Make contact with us today and see what might be possible for you. In terms of post-operative care for veneers, after spending all this time and money on them, we need to look after them and regularly monitor them and make sure that our foods and drinks don't stain, and we wear a mouth guard at night to protect them if we have tooth grinding as an issue. Regular dental visits for checkups and professional cleanings every 6 months are also essential to maintain our teeth and gums, not just our veneers. Daily oral hygiene, including brushing and flossing, is always very important to keep the underlying teeth and gums healthy. Following veneers, we're also advised to avoid bad habits like biting nails, chewing ice, or using teeth to open packages or cut fishing line. Smoking and vaping can also damage gums and stain our veneers, and veneers can be a great motivation to help giving that up for good. As you can see, veneer treatment can solve many issues, not just appearance, but also function, chewing, speech, and overall self-esteem. We encourage you to contact Anchorage Dental Care to get a little bit more information about veneers. Anchorage Dental Care is dedicated to helping patients achieve healthy and beautiful teeth. And remember, good things happen when you smile.